It's so nice when it's not
Yeah.
live with the red light.
Yep, we're on.
Cool.
All right, hi guys. We are here at Potomac Dental Center with the infamous Dr. Tambor. Say hello.
Hello everyone.
This is one of the amazing doctors here that has completely not only transformed my smile, but I'm healthier, my mouth is cleaner and free of diseases, and it's a lot, but this is an exciting part because we're now at the end of the journey. So now I get to turn the tables and the questions on him.
Usually this is my role, so it's a little bit of a role reversal right now.
Yes.
It's fun though.
So, just first of all, just let everybody know how long you've been here and why you do this.
Yeah, so I graduated dental school in 2019. I'm a Jersey boy, so I went to Rutgers University and Rutgers Dental School and everything.
Okay.
I've been at PDC for 2.5 years or so already, and I've done a lot of kind of implant continuing education and training, and it's really one of my passions is doing these kind of transformative cases where general dentistry is great, it's super important, but the thing that lights me up is literally what we're doing right now, is these kind of things that change so much beyond just your teeth. It's a lifestyle shift, and I love that.
As you can see, he's literally glowing. Like,
it's real, I do. I really love it. Yeah, for sure.
Okay, so I have afraid behind a keyboard. It happens. So
Yes.
we're going to answer those.
Absolutely.
First question, a lot of people are intimidated about getting full implants, especially regarding pain and recovery. And now that I'm on the other side of that, what do you wish that patients, I guess, knew more about the actual procedure and the recovery?
Yeah, to the dentist, which makes things kind of go in a direction where we get to a lot of these situations. And I tell everyone, the procedure itself, it should be painless, like painless, where it's not you're a little numb, it's either you're numb or you're not. So I tell patients, we'll have some, they'll be, I have a high pain tolerance. I'm like, you don't need it. Like this, if there's anything other than no pain, we're going to get you so that it's no pain. So I think that's one process where when you think about how the procedure itself, no pain whatsoever, and we have a lot of great things now in terms of pain recovery, and you've had it yourself, so it's pretty manageable, and we make it so it's as comfortable as possible from day up.
Tylenol, and I never needed more than that. It actually is a genuinely almost painless experience.
Yeah, and I haven't prescribed narcotics in years. It's one of those we have between ibuprofen and Tylenol, especially with everything going on. It's really, I'm telling you, I could count on one hand the amount of times I've had to prescribe that. So we're definitely the way the procedure's done, and then afterwards managed with just over the counter or.
When people are deciding between traditional dentures and what I got, which are implant-supported dentures, especially when it comes to eating and confidence.
We get this question a lot. So as far as traditional dentures, I also, me, I like to be very transparent.
Yes.
So I'm not someone who it's like, the day one you're going to be eating steak. Like that's just not how we heal and things like this. So full dentures without implants, traditionally they can be a 15 or 20% of your normal eating capacity. So it's a big lifestyle shift. Now we're going to go back and we're good. Implant dentures can really improve that drastically. As far as their retention, you can make them much more slim because you're having implants hold them in. A lot of this is also dependent on the bone, right? In the house, you have to have a strong foundation to support the house. So there's a lot to deciding if a patient wants to just start with traditional dentures, if we want to start with implant dentures, or if we want to start with teeth that stay in all the time. And the nice thing, we talk about this too, is the way we do things, you're easily able to upgrade in the future.
Right.
Where you see what your goals are and confidence-wise, because we want you to be comfortable. We want it to get to the point in your life when you're not thinking about your teeth.
Exactly.
You're running your business, you're out living your life, and you just happen to have great teeth, but you're not thinking about it.
Right.
I love the blooper. Sarah's like, no, we can't have it. I need the emotion.
And you offer many dental plans here at PDC. So if someone has been told that they have such a significant bone loss that they're not a candidate, what are their options?
Yeah, so the nice thing about our office here is we do conventional implants, the large implants, and also the narrow implants, which is great. It's one of those where if you think you're a carpenter and you have a bunch of tools, so we do get a lot of patients who come in because we do a lot of traditional implants, and other dentists will say you don't have enough bone for implants, because we also have these narrow implants or mini implants. We have other options when a lot of patients in the past have been told that they couldn't have dentures that snap in or anything like this. We can give them another option. So the way I look at it is it's just another tool. So we have kind of the full spectrum here.
I love that.
Yeah.
Okay, last question.
Yeah.
I've been told because in Facebook chat rooms, on social media, no one ever puts how much were they?
Yeah.
Everyone just says a lot,
Yeah.
or it's an investment, which it is very much so.
It is.
So, with a long-term investment like that, not only the price. I mean, can we disclose a ballpark for people if they were to get?
Oh, we're in the middle. We should pan to Dr. Patel right now. Get her on camera.
Say
hi.
Say hi, Dr. Patel. Back.
You got a lot to cut there,
It
don't
is.
you?
It is. I don't know if
With
Yeah, we'll
maintenance.
talk about this whole.
Mhm.
So, anytime we're giving you teeth that stay in all the time, it is a significant investment. We like to be really transparent. We'll talk to patients and say it's kind of almost like buying a car, except you'll use it more than your car, right? It's one of
100%.
it's one of those where people. It's like buying a car. I'm like, it is, but smiling, eating, chewing, all that area. So if you're asking for ranges, for teeth that stay in all the time. It can be from that, $10,000 to $20,000 per arch, ballpark, depending on extractions, things sometimes a little more, sometimes a little less. It all depends on. But the nice thing is, we have really great financing options, so that's how we're really able to make it so that, because most people obviously don't have something like that to invest in their teeth.
Sure.
We make it so that it can be sometimes even 0% interest, or just a longer time period, an issue to turn to a medical issue, they have
Sure.
infections and things. So this
100%.
kind of allows patients to start getting the treatment they need, and then kind of make it so that it's possible. It's such a global thing for your life type situation.
Absolutely.
Yeah.
Okay, so lastly, we spend all this money and we have this investment, and these teeth are not sitting in the garage, by the way. These
No,
are
they're-
driven every day, all day.
They
If
are.
you know me, you know I love to talk.
And they look awesome every time you come in. We
Thank
always
you.
say, for sure.
And I love that, because from my before, which we will put up so you guys can see my before and after, I'm really frightened for you to see this, but I will do it for you guys.
This is so amazing, by the way. I love the transparency with your audience that you do. It's and you're so good at this. I couldn't tell. You're doing a great,
Thank you.
yeah, for
Thank
sure.
you. I think it's the energy. I feed off of energy.
It's the vibe. We've spent a lot of time together at this point also. It's more like
Exactly,
friends having a conversation.
Yeah, that's exactly what it feels like. What's the return on this investment?
What's the return? It's a great question. So, it's the short answer is it's different for everyone. We'll joke. If you're opening up beer bottles with your teeth, it's not going to last as long as someone who doesn't, obviously.
Yeah.
We have patients who've been in either dentures with implants or implants for years and years and years. We have a warranty here at the office. As long as patients come in for their cleanings and things, we stand behind anything. If something breaks or something, we stand behind it. And this also, where there's maintenance, there's cleanings. We'll have some patients who come in and they'll think, oh, I've had my teeth out, I don't need to come to the dentist anymore.
Right.
It's like buying a beautiful car and being like, I should never need an oil change, I never need my tires rotated. So you've just invested all this, now we need to upkeep it.
Exactly.
So I think it's a great thing we're talking about, because it's an education thing where some people think, oh, I don't want to deal with my teeth. This is actually a great point I'll bring up. I don't want to deal with my teeth, I'll just get them all out and get implants. But that's not just you don't need to take care of it. So there are some situations we'll have patients where they don't have a lot of decay, their teeth are pretty broken down, and it's better to try to save the teeth, if they're not decayed. So because our general dental office here, we're able to do that. So it's one of those, we'll get some patients come in, they want all their teeth out. I'm like, your teeth are in really good shape, we just need some caps or cosmetic work or things.
Sure.
But as far as going back to what we were saying, the time-wise, patients take care of it. We've had patients for years and years and years with their implants function.
Great. One last quick question before you go. Tell us something that nobody would think to know.
No one thing to know about me.
Do you have any weird hobbies or like?
Did you know this about me beforehand or?
I know about a guitar.
Okay, so
guitar.
I'm a musician.
Okay.
So I was a musician before I was a dentist. Actually, today I have a new single that came out today. Actually, so I
Tell us.
actually literally today on Spotify, my artist name is Tambor. I can't believe I'm talking about this right now. This is making my oh my gosh.
Apple Tunes.
Yeah, it's so funny.
YouTube.
So, music, I kind of gig and I record music and I write. So I'm a singer-songwriter. So that's my brand. It's acoustic-driven, like arena rock. So it's big music. So it's full band and everything, but it's singer-songwriter. But it's real musicians with real music. And there's a studio here. I record in New York and now Los Angeles. So when I'm not doing dentistry, I'm a songwriter and musician.
That's amazing.
So that's the
Can I
thing.
get your autograph before you blow up?
You have more than my autograph. You have my
I
dentist, my dentist shirt, exactly.
You heard it first. Not
There you
only is an implantologist,
Right.
and what is it? What is
And prosthetics and doing teeth, but
Okay.
yeah. But when I'm not being a
Rock
guitar, when I'm not being a guitar
star.
player, singer, I also do dentistries. But I'll tell you, it kind of go back and
that.
forth. Yeah, it's just super fun.
Awesome.
Yeah, for sure.
All right, guys, this is our segment at PDC. Thanks for Sarah behind the camera today.
Yep.
And Dr. Tambor, come in and see him. He's so easy to talk to. if you have questions, hesitations, their consultation's free. They take their time, they answer your questions. Everything is transparent cost-wise. The people here are amazing. They make you feel comfortable. They don't make you feel like crap because you have bad teeth. It's just a wonderful time. Potomac Dental Center in Hagerstown.
Thank you so much. Oh my
Yeah,
gosh.
thank you for doing. Oh, I'm so excited. I can't wait to get his autograph.
Yeah.